Hello viewers, welcome to Biology in a Nutshell, and today we are going to see a topic called granuloma. So now, what is a granuloma? Granuloma is nothing but a tiny lesion which is about 1 mm in diameter, composed mainly of, predominantly it consists of macrophages. Okay, not normal macrophages but a modified macrophage called the epithelioid cells, which are rimmed at the periphery by lymphoid cells. Okay, so as you can see in this picture below, this yellowish part can be representing macrophages, and the orange color part, okay, which is surrounding the macrophages, that is rimmed at the periphery, okay, are the lymphoid cells. So now, what is the pathogenesis of a granuloma? What do you mean by the term pathogenesis first? Pathogenesis is nothing but the sequence sequence of events which happens in the formation of a disease. Okay, it is in a common man's language, pathogenesis means that. Okay, so now let's see what is the pathogenesis of a granuloma. Granuloma first begins as a hypersensitivity reaction. Okay, to be more specific, it is a type 4 hypersensitivity reaction. This granuloma has something called a sequence of evolution, which consists mainly of 3 steps. First one is engulfment by macrophages, second one something to deal with CD4 plus T cells, and the third one is something to deal with cytokines. So now, the first step, engulfment by macrophages. Our macrophage here, as you can see in the picture, will try to engulf the antigen. Why it has to engulf the antigen is, it wants to destroy the antigen. Because antigens are not good to be present in our body, this macrophages comes and engulfs it, trying to destroy. But our macrophage will fail. It will not be able to destroy the antigen because the antigen is poorly biodegradable. Now the macrophage will undergo some morphologic changes to become something even more powerful called epithelioid cells. The next one, the second one, CD4 plus T cells. What does CD4 plus T cells do? Macrophages now has the antigen. Okay, the macrophages will take the antigen and present it to CD4 plus T cells. Now the CD4 plus T cells will get activated. Okay, will get activated and start releasing lymphokines. Lymphokines are also known as cytokines. What kind of cytokines are released? Interleukin 1, interleukin 2, interferon gamma, and tumor necrosis factor alpha. So as I previously said, cytokines are released by CD4 plus T cells. And I also mentioned which all cytokines are released. That is interleukin 1 and 2, interferon gamma, tumor necrosis factor alpha. Now what do these cytokines do specifically? Let's see their functions and roles. Interleukin alpha will activate and proliferate T cells. Interferon gamma will activate macrophages. Tumor necrosis factor alpha has 2 functions. First one is to promote fibroblast proliferation, and the second one is to activate endothelium, resulting in the production of prostaglandins. And we all know that prostaglandins are related to inflammation. So despite these cytokines, there is something called as growth factor also, which is produced by activated macrophages, which will stimulate the fibroblast growth. Already tumor necrosis factor is promoting fibroblast proliferation. Now this growth factor is also stimulating fibroblast growth. So we would like to now jump into conclusion. Okay, so what is a granuloma? As you can see in this picture, granuloma has in the center macrophages, and at the periphery it has lymphoid cells. At the periphery it has lymphoid cells, and it also has some fibroblast for healing purpose. So a granuloma can be defined as a tiny circumscribed lesion predominantly consisting of macrophages rimmed at the periphery by lymphoid cells. So that's it for today. Thank you. And if you want more videos like this, you can subscribe our channel and press the like button. Thank you.